Solutions conversations of the Roundtable. This is, my name is Tiffany Herndon. This is Miss
Debbie Mabry.
Catherine.
We're going to be talking today about effects of psychotropic or let's say medications on the libido. One of the pieces is going to be within the marriage. I tend to see quite a few couples after somebody has found out they have a diagnosis, they work on getting that diagnosis managed, and part of their piece might be medications. But then the piece they don't expect a lot of times is the change of libido within the relationship.
I know that with many of my clients, a lot of your borderlines do have comorbidities, which mean that there are other disorders that go with that can kind of get in the way, confuse things a little bit. And it's often depression, anxiety, and those two comorbidities are often medicated. We don't medicate for borderline personality disorder because that is learned.
Oh.
And we do the DBT classes that you guys work with. We do those instead of medications.
So what does that mean? It's learned. There's no
It's
medication.
learned. It's learned. It's childhood based. We do know that just sometimes life can train you to not trust. Sometimes life can train you to give up. It's experiences, and so a lot of and new research has recently shown or suggested that mirror neurons in newborns have to do also with development of borderline personality disorder. But many of the women take antidepressants, anti-anxiety medications to deal with the anxiety, the depression that go with BPD. And these extra medications can often kill their sex drive.
I think it's difficult because let's say somebody has stress. Stress is one of the biggest killers of the libido itself, whether you're on medication or not. So somebody's dealing with the stress they have in life, and then they take medication to help the stress get better, and yet the libido may not change because of the medication itself. So that may be a piece that kind of stays the same throughout that, or they'll get on medications to feel better in different areas, and that's something they might lose.
One of the problems with this, other than the obvious problem, one of the problems with this is that this is not something that couples will talk to each other about. There's a lot of ego involved in it.
Potential hurt or feeling rejected.
And most of the time that rejection is the main issue. It's so funny because they'll talk to you in marriage therapy, we talk about communication, but we're not communicating on what a basic problem is that there's no sex. And they don't want to talk to the other person about it because their feelings are hurt. You're ignoring me. You don't find me attractive. So many different blames we put on ourselves when actually if you were confronted with that opportunity, you wouldn't want to do it anyway because you're tired, you want to go to sleep. And the medication just makes you tireder. The medication is better than 5 cold showers, back to back to back. And when you have two people in a relationship and both of them are on the medication and won't talk about it. Yeah, one of the main things, like I said earlier, is the medication. But it's not just for antidepressants or anti-anxiety. There are lists here of quite a few different medications that kill the complete libido. There is a psychiatrist here in town. She works out in Fort Hood right now, and her name is Dr. Kavanaugh. Dr. Kavanaugh told me many years ago, we were talking about homeopathic remedies, and we were talking about vitamin supplements, and she was very concerned that many times clients who are on medication will read something that sounds very promising, some type of a vitamin, and they don't stop to think that that vitamin might interact negatively with their medication. And a lot of people don't seem to know that you don't just stop medication, just boom, stop it and pick up something else. You wean yourself off. But the bottom line to all of this is that none of that should be done until you talk to your doctor. And that was what really bothered her, is that she said so many patients don't realize that that's necessary. That, I mean, these are powerful vitamins, powerful minerals that can have some side effects. So she really stressed that, and I think I just wanted to get that out there, that as we're talking about these medications, don't just quit taking them.
Right.
And if you find that you're not interested in sex anymore, talk to your physician about it. Don't just go buy something in a nutrition store, guaranteed, and don't quit your meds, because that's going to end up hurting you in a lot of different ways. So with that being said,
Key one, bring it into conversation with your therapist, with your physician. If sex is something that is bothering you or bothering you as a couple, then, okay, the person with no libido often comes in saying, well, it's not bothering me because I have no libido, I don't want anything. Now, the other person says, I feel needy, I feel rejected, I feel a change in the relationship, I need something to change. So bring it into conversation. And for the person who has no libido, I think trying to have, once the communication starts, you can find ways of compromise. It's not meant to be a power struggle. It's meant to be, honestly, drawing you in closer together as a couple with the intimacy. Things I want to add too, some of the top medications are, that I think people may not think of as the blood pressure medication, antidepressants. But the other ones that really play a big part, one is going to be alcohol. I know this is not a medication. If you drink, it is a depressant. Mm-hmm. The more you drink, as you come off the alcohol, it will lower your libido. It may raise it initially, very short period of time, and then it will lower it afterwards. Same thing with tobacco. Tobacco closes the blood, what are they called? The arteries, the blood vessels. It narrows them. So you're going to naturally have less libido if you smoke, if you use a lot of tobacco. Those are good to keep in mind when, let's say, they exacerbate or they get worse after you get on medication. You may be able to do other things rather than even mess with the medication to find that they get better. So going into the route of ways to help libido or address it once you're on medications. What route can we go with that?
well, I wanted to add a couple more meds.
Okay,
What you were
go for
talking about. Some of the big offenders, repeat offenders here for lower libido are Prozac, Zoloft, Celexa, Elavil. Some of these are serotonin reuptake inhibitors. They're called SSRIs, and that's your Zoloft, your Prozac. And then you have tricyclic antidepressants such as Elavil. Elavil is an older one, but it's still scripted. The anti-seizure drugs such as Lamictal, Trileptal, Depakote, all of those good guys, they're now used, anti-seizure drugs are often used now as mood stabilizers. And they too are used not only for seizures and bipolar, but sometimes they're used for anxiety and depression. We've seen that quite a bit in this area recently. The way they work is by preventing impulses from traveling along the nerve cell, because sensory input triggers body responses. So if the meds dampen the nerve impulses, it's also going to dampen any type of positive sensations. So exactly what might be caused to stimulate you no longer will, and you're thinking once again that something's wrong with you, or your partner's thinking that it's them. And that's just one of the anti-seizure drugs. Mm-hmm. And we know that many people are on these medications. If you have seizures once or twice, they keep you on for a year plus. Mm-hmm. And the opioids, yeah, Vicodin, OxyContin, Percocet, all of that can lower your testosterone, the male hormone. It can lower it, and once again, no performance with that.
Just a thought is that women have less testosterone than men. We know this, but the testosterone is often what like increases the libido. So let's say if we picture testosterone like in a cup, for a man who might take the medication, he might be like a half full cup. For a woman, she might take that same medication and she has nothing left.
True.
Because she has less testosterone to begin with. So
True.
medications might affect men different than women.
How about antihistamines? And we live in the allergy capital of the world, Killeen, Texas, Central Texas. And any day of the year, you see people around here sniffing and snorting. And so antihistamines are something everyone around here carries with them. Benadryl, one of the oldest, Benadryl will totally wipe out your libido.
Can I also point out there's a correlation between Benadryl and Alzheimer's?
Ooh, no, talk.
And the older you are and taking Benadryl, the higher it increases the correlation for Alzheimer's. It's fascinating.
Yeah.
So Benadryl does a lot.
Yeah. How about chlortrimetron?
I don't know what that is.
Okay,
Yeah.
it's similar to Benadryl. Oh, and then there's medical marijuana.
Mm.
That one I read, it affects each person differently. Some people it increases their libido, other people it kills it. So that one can be unique.
So that one can either put you over the edge or under the ground, right?
I don't know.
I bet you a lot of people didn't know that marijuana would affect you like that.
This is just such a hot topic to discuss, sex drive.
Beta
To
blockers.
begin with,
Beta blockers. If you have migraines, chances are you know what a beta blocker is. It's a blood pressure medication that they often give people with migraines to take on a daily basis, and it encourages the blood flow to the brain, and that of course is going to do just the opposite. It's going to lower your blood pressure, which lowers your blood pressure everywhere.
no.
Everywhere. Yes, it does. Everywhere. And let's see, some of the more popular ones are propranolol and metoprolol. And it even says that eye drops containing beta blocker, timolol, used to treat glaucoma, can decrease libido. Yeah.
I don't know what is that.
There's a side note on this research, and it says although all beta blockers lower blood pressure, they do it in different ways. So do talk to your physician. And then of course there are benzos. People taking Xanax often lose their sex drive.
Oh, wow.
Benzos are used for severe anxiety, and anxiety itself, wouldn't that be a cold shower?
Can be. Just like depression.
Absolutely.
All by itself.
Mhm.
Yeah.
Yeah, usually sex is not something people who are in those states are very concerned about.
I think it's good to recognize this is going to be different for the person who gets on the medication as well as the person who's married to the individual getting on medication. So let's say if my spouse has extreme anxiety and there's no libido, then I might think, oh good, once we get this stress out of the way, once things get normal and we're in a good routine, then we'll have the intimacy I've always wanted. And I think that could be really disappointing once they get on, let's say they get on the either antidepressants or they get on the medication, and then you find they may not be stressed anymore. Their quality of life may be much better, but it does not mean that they'll have a sex drive that you were maybe hoping for.
This research in front of me talks about adrenal fatigue. And it says that adrenal fatigue can often happen when the cortisol levels are too high or even too low, and the adrenaline bottoms out. the person says that eating junk food is what people want to do whenever the adrenal fatigue hits. And having sex is the last thing you want to do.
The cortisol will happen at the expense of the testosterone. Those two act in tandem. I think it would have been called in positive ways that they directly affect each other. So the longer that stress is there, the longer the fatigue is there, it will be at the expense of the testosterone, which is the libido.
The endocrine system is what's heavily affected here. The sluggish thyroid, also in the endocrine system.
That's a good one.
They suggest that you have the physical if you are having low libido issues, that you go have a complete physical, have labs done. Once again, the adrenal gland, the thyroid, those are in the endocrine system. And so you need your labs. And they say that sleep, reducing stress, you're right, reducing that stress is a big part of it. Gut problems.
It's not funny.
No, it's not. Gastrointestinal system.
Big deal now.
No, gut. The word gut is funny to me.
It's a big deal now.
It
We have
is.
issues with leaky gut syndrome. We have IBS. We have all these new issues that we haven't had before.
Have you heard of the gastrointestinal system being known as your second brain?
Kind of.
Yeah.
I mean, I would totally have problems with libido if I didn't know if I could control myself down there or not.
Said that leaky
With the
gut,
IBS, something like that. I mean,
leaky gut syndrome can weaken the brain hormone connection. That's
Yes.
what you're talking about.
That's because the barrier breaks down in the intestines
Mhm.
and allows larger particles to go through than it should, and it sees it as it sees that as a foreign object, so it increases your white blood cell count, which then you're fighting a supposed infection, which of course decreases your brain.
It's true. Your brain has to send the attention down there, but then
Yeah.
do the rest.
Have you heard of something called food medicine? It's a way to clean your system just through food.
Oh yeah, eating clean?
Bone broth
Mm-hmm.
and celery juice.
Yeah. Yeah.
That's very interesting. Sex hormone imbalances, that would go back to the birth control pills.
And the reason that helps your gut is because it takes the burden off of your gut working so that it can heal.
Okay.
So,
Birth control pills, that's a big mood killer.
that's
Yeah.
yeah.
They suggest IUDs instead. No.
Well, see, and I remember there was a doctor who was like, "It's just a hormone," and I'm like, I know people who've gone into panic attacks because of birth control. Like they took 2 in one day. The extra hormones just flooded the system. So just a hormone is not good.
It's a hormone.
This doctor was previously a mechanic. So I don't know how I felt about that either.
Just a hormone.
Get your car checked out. Have you heard of a connection between diabetes and sex drive?
Of course.
Mm.
Of course. Yes. People with diabetes do not feel well at all.
Metabolic syndrome, PCOS. It can cause facial hair growth in women,
Low hormone.
balding and acne. Once again, do your lab work and diet. This individual has a lot to do with changing diet as far as helping your body.
Well, we didn't have all of these problems 50 years ago. They were
Will
around.
Cole was his name.
We didn't have all of these medications 50 years ago.
And they were still dealing with the same disorders.
IBS.
Yeah.
IBS is a newer thing. There's more people diagnosed than before.
I think that's a key too, is I think as they're learning the body, as they continue to gain research, they're learning new things and they're becoming more specific, like diabetes, let's say. Maybe it was around partially before, but now they're seeing it.
I think it could pertain to the GMOs and the fact that we're poisoning our food in higher than ever proportions, which we are now poisoning ourselves.
When I think of, like, okay, let's say somebody has admittedly what they call a bad diet, or if they feel like, okay, I'm eating out all the time, I'm not eating anything green, like whatever takes me 2 minutes to make, I'm going with that.
Processed, high salt.
Yeah. So I mean, it's like, how do we usually feel about ourselves when we feel stuffed to the gills, or we feel bloated, or we feel like your body is like slowing down because it needs to process the food you just ate? We're not gonna have Rita because we feel bad about ourselves. We're not
Feel
gonna
bad about ourselves because I feel pretty good about myself when I'm totally comfort fooded out.
Yeah.
Yeah.
Okay.
Oh yeah.
But so then it may depend on the person then. If you find that when you are like bloated and stuffed, you don't feel good,
Well, it depends.
like, go with that.
Like I ate a whole bunch of pasta last night. I felt pretty good. I'm not feeling too good. Today, might be regretting it a little bit. But last night, man, that was the best stuff ever.
Yeah. So pay attention to how you feel. When you feel stressed, when you feel like, let's say you don't feel good about yourself, whether you eat or don't eat, or whether it's something else, then that's gonna hurt you.
No, I went to the gym and I was allowed to carb load, so I did.
I wasn't talking about
Okay.
you. Oh,
Yeah.
it's gonna be unique.
It said that high insulin levels reduce the body's ability to make the growth hormone, which also changes testosterone levels.
Growth hormones are a big thing in fitness now. You can go to a nutrition shop and get growth hormones and start taking them.
But once again, you're talking in the endocrine system really goes into spin here. Nutrient deficiencies, low levels of nutrients such as zinc and vitamin D cause low sex drive. Well, low vitamin D causes depression, so that would make sense. Insufficient healthy fats.
Yes.
So the good fats are coconut oil, avocados, ghee, olive oil.
Flaxseed oil, chia seeds.
I am curious, Ms. Debbie, what do you think of when you say the endocrine system?
Yes.
What is it as a therapist kind of that you think of it affecting?
I think of growth. I think of weight. So many. I think pituitary gland, thyroid. I think of melatonin. What is it? The pineal gland that produces melatonin, and that, of course, is it's a sleep aid that our body produces. They sell it as a supplement at Walmart and all kinds of different stores. And so if our body is in a stress mode and we're not producing enough melatonin, then we're not going to sleep well. The endocrine system is so fascinating because of this base control that it has over us. And it just seems that diet is so related to it.
So these could all be connected too. If you're not sleeping well, if you have low libido, if you find that you're gaining weight, even with eating healthy, like a thyroid difficulty, or if you find the insulin, you have low, blood sugar dips. All of these could be something where you go to the physician to kind of find out if there's a center.
And if you have depression and you go in and they can find all those same things related to that. I think one of the key things here is if something's wrong, go talk to your doctor.
Right.
Go talk to someone about it. And if you go talk to your therapist about it, your therapist is going to tell you, go talk to your doctor. And have some tests run. Let's see what's wrong, because you don't have to live like this.
Look at your diet. Check out your diet.
Yes.
Change your diet and see if it helps too.
Mm-hmm.
If you change your diet and you stop eating processed foods and refined sugars and breads, and you still feel bad, that something's probably seriously wrong and you really need to go talk to your doctor.
Dr. Hyman right here says that sugar also lowers libido.
And
I'm
well,
sure diet can do it.
And there's a new thing out that talks about how cheese is as addictive as crack cocaine. And so sugar, we all know sugar lights up the brain.
Yeah,
And cheese
yeah.
does too. It's the saddest thing ever.
That's funny.
Oh.
So sad.
So if we put sugar and cheese together,
And white bread.
oh no, then that explains. Like cream cheese and sugar mixed
Ooh,
together.
Cheesecake.
Cheesecake! It's
Her
the
all
new
in
crack.
It-
Cheesecake is the new
I don't
crack.
know if it's the new crack. I mean, that's.
It's the old
kind of in there
crack.
for
It's
a
the
while.
original crack. That's it. Sugar and cheese.
Not just sugar and cheese. There's a
Oh.
lot of.
I love bacon.
There's chocolate.
I love
Bacon.
bacon.
Bacon's one of them too. Yeah,
I
definitely.
love bacon. So if we made some kind of a dessert
Mhm.
with sugar, cheese, bacon, and chocolate.
That'd be perfect.
Uh-huh.
Sign me up.
Chocolate bacon cheesecake.
Yes.
Oh, that's horrible.
With,
on the
now with
other.
the bacon crumble on the crust.
So that's salty, sweet salty.
Sweet sauce.
Yeah, that's it. We're gonna be either wealthy or obese. We're gonna be one of the two, okay?
And have no libido.
A piece of this too is I want to encourage those who you may feel like you are eating healthy and you're doing these things and you notice it shift right after you started medication. If you notice it was not like this, you've been married or you've been together for this many years, it was not like this at all, you got on medication, all of a sudden everything changed. Being willing to have a communication about it, that is going to be huge. You may end up changing your definition. I'm not saying of sex, but don't write off intimacy because that will affect your relationship. It will affect, if it's not for the person who has no libido, it will affect the relationship for the person who has libido still. Problem solving, finding ways if it's redefining intimacy for what you as a couple do. And honestly, a lot of that can pull out that stress, that self-blame for either the person who has libido saying, I'm not good enough anymore, or the person who has you guys are making out your right notes. Or the person who
She said, tell Michelle Moore, we need a bacon-crusted cheesecake.
I'm telling you.
she's like our little bakery lady.
Michelle Moore is this amazing, amazing chef, and we're very, very fortunate. She's one of our interns here, an LMFT associate. And so she's writing a cookbook. It's amazing. We give her a plug. Anyway, she can cook anything, so we may be onto something.
Yeah, I know.
I'm sorry, Tiffany. Let's get back to the science.
No, it's okay. But the willingness to have it as a conversation, to come out with all the things that are what's the word I'm looking for? Not polite? I don't know. To just come out and talk about it. I see a lot of couples that they're like, well, we could go into this area, and they're not sure if I feel comfortable talking about sex. This is what part of what we do in couples therapy. We cover all the bases. We're not shy about it. So bring it into conversation.
Because we as therapists, we want to increase communication between couples as marriage and family therapists. That's what our goal is. And what people forget is that those intimate interactions, they're also a form of communication.
Mm-hmm.
They're not put into words as in how increasing, just conflict resolution and stuff like that, but is a way to express how you feel to your partner. So it's extremely important.
And we do have, there's a lot of research that shows that different brain chemicals are activated through touching, through sex. You have acetylcholine, that's a big one. GABA's a big one. What are the other ones?
Testosterone is absorbed.
Touching
Oxytocin.
Oxytocin. Yeah, not Oxycontin.
No.
That's back on opioids.
No.
Opioids, yes. Yeah, your body does not produce Oxycontin when you touch somebody.
It
Yeah.
probably increases serotonin as well.
Yes, it does. It does, and so all of the, and our brains crave this good stuff. These are
Yes.
happy chemicals. And so
That's why sugar and cheese.
that's why we emotionally eat, is to replace the good chemicals, is to give us these little
Well,
peaks. That's why Kathy eats pasta.
yeah. Seriously, like
Yes.
I need some comforts.
Yeah,
I'm not gonna deny it.
yeah. What's your comfort
Bread.
food?
Oh, chocolate.
Chocolate's your
Hands down.
comfort food?
Yeah. And coffee.
And coffee.
Yeah.
Mm-hmm.
I'm gonna get a bacon crusted cheesecake, and that's gonna be it.
That's gonna be your
With
comfort
chocolate.
food.
Chocolate covered bacon crumbles with cheesecake.
Okay. I think my comfort food is gumbo,
Yeah.
and homemade bread, and buttermilk pie.
Ooh, I like that.
I know. Oh, it's a shame you never met my grandmother. Mm-mm-mm. Yeah, those were her things. Not the homemade bread, but the buttermilk pies. And my papa and my grandpa, pecan pies
Yes,
that just make you want to
balance.
cry. They're so good. Pie. It's all about pie. Pie, coffee, tea, gumbo.
Now remember, food's not a substitute
But it
for
should
emotional connection. And eating too much food can decrease your emotional connection, because obesity is also another issue with
with
intimacy,
low libido.
low libido. Yeah.
I know that we used to talk about midlife crisis. Remember that?
Yeah.
And it had to do with the changing of hormones.
Mhm.
And I think if I remember correctly, I was told that because the hormones dipped, that the solution to that was to either eat chocolate or buy a Maserati.
That sounds good to me.
Yeah.
Yeah. I'm
Maserati.
taking the Maserati.
So, any spending is going to give you that little thing. Why did they who told you the Maserati?
Why? Especially because our
Why?
society primes us.
Mhm.
It uses Freudian psychology to prime us to spend things to feel better. But we never feel just like the food.
Shopping is such an addiction. We'll talk about that later.
Are we good
Exercise.
there?
What about exercise?
That, I swear there's a demon called Exerciso,
There we go.
and he
And-
possesses people, and that's why they exercise. I don't think it's normal. I know both of these women are really into exercising. They're very healthy. But I don't follow the crowd. I'm just saying. I think for myself.
She comes from a different generation.
So this is probably about the time we call again. Anything else, ladies, before we let you guys go back?
What?
Ways to kidnap therapists. Disappear.
101.
Thanks for joining us today.
Yeah. Bye.
You take care of yourself. Bye-bye.
You don't have this better.